One.
Thank you for joining us today. I'm Bruce Goldstein, President of Farmworker Justice. Welcome to the Facebook program series, The State of Farmworkers in America in the COVID-19 era. Farm workers have been designated essential workers to ensure our nation's food security during the COVID-19 epidemic. Yet their working conditions and living conditions create grave risks to their health and economic status. These programs will raise awareness about the serious challenges the pandemic imposes on farm workers and their family members each and every day. The series will identify impactful work and innovative ideas being carried out by Farmworker Justice and other organizations that represent and serve farm workers around the country. We're very pleased to have you with us to hear about the important work that's being done on behalf of farm workers and the important efforts that farm workers themselves are making to confront the pandemic of COVID-19. So I'm very pleased to introduce our first guest today. She is Alexis Guild. Alexis is the Director of Health Programs and Policy at Farmworker Justice. She is my colleague, and we're very pleased to have you, Alexis. Welcome.
Thank you so much for inviting me to join.
Alexis, as Director of Health Policy and Programs, leads our work on health policy, works with many organizations around the country to help farm workers improve their access to healthcare and improve the healthcare institutions' ability to serve farm workers. So let's start with our first question. Alexis, health is obviously at the forefront of everyone's minds. Farm workers have been designated as essential workers. They're at the front lines of the pandemic. They've got to work, both to earn a living, but also because we've told them you're essential and the food sector is essential. You need to be working, but that poses incredible risks. What are the primary health care challenges faced by farm workers, and how has COVID-19 exacerbated these challenges?
Well, even prior to the pandemic, farm workers faced numerous healthcare challenges. Among those, lack of health insurance, limited access to clinics due to limited transportation options, as well as lack of sick leave. Many farm workers need to choose between going to the doctor or taking family members to the doctor and losing wages that they would have in the fields if they stayed in the fields, as opposed to going to access healthcare. There's also a lack of information about the U.S. healthcare system, about health centers, about the opportunities and options for farm workers and their families to access healthcare. And actually, it's been complicated by the administration's recent public charge rule that basically limits who is able to access Medicaid due to potential immigration consequences. So there has been a lack of information and misinformation about how Medicaid impacts your ability to adjust your immigration status and to whom public charge applies. And that has created a lot of fear and has created a chilling effect where farm workers, even eligible family members or workers who are eligible for Medicaid, will not enroll in Medicaid or access healthcare due to fear of immigration consequences. And since the beginning of the pandemic, we've heard from our partners on the ground, migrant health centers, legal services organizations, that all these challenges have been exacerbated. Unfortunately, many health centers and legal services organizations had to limit or suspend their outreach. And outreach and education, as you know, is crucial. They provide that link between farm workers and health centers and other resources in their communities, and they really provide that warm handoff. And so that limited ability to do that in-person outreach has really impacted the way that farm workers are able to access healthcare and are able to understand their options as the pandemic continues in their communities. It is important to note that, because I mentioned public charge, that USCIS did announce that COVID-19 testing and treatment will not count towards public charge, but there is still so much misinformation, and the public charge rule is still in effect. And so even though USCIS put out this guidance, there still is misinformation and fear, and that is really impacting workers' ability and their accessibility to healthcare services.
Thank you. And just to provide a little bit of context to our listeners who may not know a lot about farm workers, there are an estimated 2.5 million farm workers. More than 80% of them are immigrants, they were born abroad. And in the last 10 or 15 years, a lot of those immigrants have come from indigenous communities, often in southern Mexico, but elsewhere as well. And for those indigenous people, many of them speak a language other than Spanish or English. So all the outreach that Alexis has been referring to help farm workers get benefits and medical services that they're entitled to or eligible for, it can be a real challenge. So Alexis, you got into this a little bit, but why don't you tell us a little bit more deeply about how farm workers living in working conditions affect their ability to protect themselves from COVID-19?
So it's very difficult for farm workers to abide by CDC recommendations, especially for physical distancing and hand washing. So in the field, workers tend to work in close proximity to each other. They may share tools. There are supposed to be hand washing stations in the field accessible to workers. However, that's not always the case. And even if there are hand washing stations, they may be quite a distance away from where the worker is actually working. And ideally, there would be soap and single-use towels, but not always. And they also have to take time out of their work in order to go and wash their hands. And again, that's wages lost. And so in the fields, it's extremely difficult for workers to abide by those recommendations. And then at home, workers tend to live in crowded conditions, unfortunately, and there are many reasons for that. One being that housing is expensive and workers have low wages and can't necessarily afford to live on their own. So often they work and live together in order to save money so that the wages that they do earn can go towards other necessities, as well as perhaps family members in other parts of the country or in other countries, in their home countries. Some workers do live in employer-provided housing, especially H-2A workers, and those also tend to be crowded. There tend to be multiple people living under one roof. They share kitchen facilities, they share bathing facilities, and they may not be able to have those supplies such as soap and warm water and single-use towels in order to truly be able to protect themselves from COVID-19. The challenge is that if there is someone who tests positive for COVID-19, or if they are sick with COVID-19, these living and working conditions can create quick transmission amongst the workers, and that's really worrisome. And so we need to make sure that workers have the tools that they need, the supplies that they need in order to protect themselves from COVID-19 in the fields and at home.
Right. Thank you. And you mentioned the H-2A Temporary Foreign Agricultural Worker Program. It's a guest worker program. And President Trump, in a late night tweet last night, said that he's planning to issue an executive order to terminate immigration to the United States. But there are media reports this morning that he will make some exceptions, and that one of those exceptions will be that agricultural employers will be permitted to continue to bring in agricultural guest workers from abroad on temporary work visas. So as you said, they're often transported in crowded buses from near the border in Mexico or by plane, and then they are housed in crowded housing, and they are dependent upon that one employer for their job and for their health. And so Farmworker Justice is part of a coalition of organizations that has demanded that the Trump administration require employers to provide safety protections for these particularly vulnerable guest workers. who may become one of the major exceptions if Trump goes through with his efforts to terminate immigration. So let's turn to another question that we have for you, which is, what can we all do to help farm workers stay healthy and access health care during the COVID pandemic?
So we need to make sure that there are enforceable standards. So Farm Worker Justice is working with other advocates across the country to push OSHA to create emergency temporary standard specific to COVID-19, to put in place protections for farm workers and other frontline essential workers. Because right now it seems from conversations we've had with organizations on the ground that the ability for workers to protect themselves really varies by the employer. So some employers are providing the tools, providing the supplies, and providing the physical distancing so that farm workers can protect themselves. But that's not universal. And in order to ensure that there's universal adoption of these guidelines, to make sure that farm workers who are at the front lines of the pandemic and essential to our food supply, to make sure that they are healthy and protect themselves, it's important that every employer has a standard that they must abide by that's enforceable, to make sure that the worker, wherever they may be, for whomever they may work, are able to protect themselves and have the ability to protect themselves. It's also important that we support community health centers and migrant health centers. They are at the front lines of this pandemic. They've always been the first line of healthcare for many farm workers and their families. They provide essential services to farm worker communities. And this pandemic has been difficult financially on these health centers. So it's important that there's funding available, additional funding to migrant health centers specifically, and to rural healthcare, including hospitals and other rural health facilities, to make sure that farm workers and their family members have options. So when they do get sick, they're able to access the healthcare that they need. We also, need to make sure that there's testing available to farm workers. Given the working and living conditions of farm workers, if they don't have access to testing, if they're not a priority for testing, then it's more likely that there could be transmission amongst workers. So it's important that we identify testing, that we are able to get tests out to farm worker communities, so we are able to make sure that farm workers are able to maintain healthy working environments. And we've been working with organizations across the country, advocates, health centers, legal services all over the country, in order to raise the issues of farm workers, both to members of Congress and the administration, to make sure that these protections are put in place and protect the health of farm workers and their families.
Thank you. And we work with groups all over the country, and we ask those groups who are on the ground to tell us, what they're seeing and hearing from farm workers themselves. And unfortunately, we're hearing that in a lot of places, agricultural employers are not abiding by the CDC recommendations. Now, there are certainly agricultural employers that we've heard of that are trying to follow the physical distancing and sanitation and other efforts to help prevent COVID-19 and to arrange for healthcare when farm workers need it. But too often we've been hearing that that's not the case. And in many parts of the country, the agricultural work, as we speak in April, is really just beginning. Mm-hmm. And so what we're very concerned about is that as these seasons begin and the work really ramps up, and workers are working in groups and they're being transported back and forth to the job, that we're going to see an increase in COVID-19 among farm workers. So we are working with many organizations around the country in a variety of ways to try to educate farm workers, to try to press states and the federal government to insist on stronger standards, to improve the resources available to rural health care, to try to help farm workers. But you know, when it comes down to it, we need a lot of employers to step up and help farm workers ensure that they are protected, and that will ensure not only the protection of farm workers, but it'll protect the food supply in this country. So that ends our show for today. I want to thank our listeners for joining us. I want to thank a number of the organizations around the country that have been circulating information about this series, and I want to thank my colleague Alexis Guild, our Director of Health Policy and Programs, for providing this valuable information today.
Thank you. Thank you for inviting me to join. And we look forward to continuing our work to protect farm workers and to make sure that farm workers are able to stay healthy throughout this pandemic and beyond.
And we have a great set of shows coming up, and we look forward to you joining us then. Thank you, and goodbye for now.